My name's Michael Flynn and I live in Bisping in Blackpool. Since April 12th last year I've been in and out of hospital. Had pneumonia last April and I was in overnight, and then I was back in for 5 nights in May last year on ward 24, who were brilliant. And then I've been in and out since. And I've got sarcoidosis and asthma and been referred to Preston specialist asthma team. I work for Health Watch Blackpool, which is part of Empowerment in Bisping. I have someone, when I go to appointments at my doctors or GPs, I always have my boss, Beth, always comes with me. Or when I go and see, like I saw Dr. Villaris yesterday. So I do prefer someone to come with me, so it would help if there was someone sort of there to support me, because I'm coming up on my own, so it'd be good to have someone from like the LD nurse there to support, because when I was in on ward 24 I had someone called Leanne Geegan from work, and she was sort of my go-between between me and the hospital. She'd get the information off the hospital and relay it to me in a way that I'd understand, because you get all the hospital jargon, so she'd relay it back to me in a way that I understand, because I have a learning disability. So it's like, what do you mean? So she'd get the information and then relay it back to me, which she shouldn't have to do because she was doing this out of her work hours. So should be someone there from the LD side to come to you and explain it to you, rather than have a third party explain it to you. Always ask me if I need help and if I've got my hospital passport, because I have additional needs like Asperger's, asthma and sarcoidosis. So yeah, it would be great if staff would ask if I have that, where it's got all my information.
In June 2020, the Trust signed up to the Hidden Disability Scheme. We were the first NHS Trust to do this in the north of England. Reception desks across all of our sites have the Hidden Disability sunflower lanyards available for patients or carers to wear. The lanyards alert our staff that the patient may need some assistance during their stay or appointment.
Yeah, the lanyards are really positive and good. I don't do meeting new people because I get nervous when I meet new people, and it's just different environments, meeting new people, different. I don't socialise a lot because I find it hard to socialise. Once I went to Whitegate Drive, the old urgent care part, and the receptionist saw that I had my sunflower lanyard on, and it did make a difference, because she says, do you need somewhere quiet to sit, or do you want just happy? And I thought, well, yeah, so she gave me a quiet area to sit in, away from the other people.
So thank you, Michael, for your input and sharing your experiences with us. That was great. Firstly, I'd like to introduce myself. I'm Sarah Ward. I'm the new lead nurse for learning disabilities and dementia at the Trust. So thank you again for sharing your experiences. At Blackpool Teaching Hospitals, we are working hard to make sure that people with a learning disability have a good experience when they use Blackpool Teaching Hospital services. And it was really great to hear that you bring your hospital passport with you, and that your sunflower lanyard was useful for you, and that alerted staff that you had some specific needs. We want to make sure that that's the same for everybody with a learning disability when they use Blackpool Teaching Hospitals, and we want to make sure that staff know about people's hospital passports and that they use them and read them. We're developing the role of the learning disability champions as well, so that will allow key people in clinical areas to have them additional skills and knowledge in supporting people with a learning disability. They will ensure that the staff ask for hospital passports and read them. And they will also be making sure that staff apply them reasonable adjustments for people. And reasonable adjustments can be anything from making sure that an appointment is at the right time for somebody, making that appointment time longer for somebody, or simply making sure that the information that we share with people is understandable. So getting rid of that medical jargon that you talked about. We aim to work in partnership with families, support workers and carers, because then people are the experts. They know people really well. They know what people's wants and wishes and needs are. I hope that next time you come to Blackpool Teaching Hospitals, your appointment or your visit is smooth. I hope you get to meet one of our champions. And I hope that you get the information that you need in a way that is suitable for you. So thank you very much.